Hi folks, I'm Dr. Ed Beyer. I am a chiropractic physician right here in Tinley Park, Illinois. I've been in practice for 24 years. And over the years, obviously as a chiropractor, I've seen a lot of lower back pain, disc problems, lumbar stenosis, sciatica, you name it, I've seen it. Facet joint hypertrophy or inflammation. And what I want to talk about for just a couple minutes today is your lower back pain coming from your brain? Okay? What I want to explain to you is something that a lot of doctors, most doctors don't look for. As a functional neurologist, I understand that all of the muscles that line our lower back are controlled by an area in your brain, and this area is called the cerebellum. This is the back of the brain, and this is the cerebellum right here. Now the cerebellum does a lot of different functions, but one of its functions is to make sure that the back muscles, the small intrinsic core muscles of your spine, don't get too tight. If the cerebellum gets weak, and there's multiple reasons why how that can happen, then these muscles in your back are going to become way too tight. Now, I look for this as a functional neurologist, and we're going to treat your lower back condition with spinal decompression and all the different latest innovations that are for that, but we're also going to look at the cerebellum. Now at home, you can do a little test to see if your cerebellum is working properly. The first test is called a Romberg's test. You stand with your feet together, you're not touching anything, your hands are at your side, you close your eyes, and you should be able to hold as still as a statue for about 10 seconds. If you're wobbling one way or the other, that's a sign of a weak cerebellum, and then if you are suffering from lower back pain, that's part of it, I'm telling you. Now, another test you can do is called a finger to nose test. This is a lot of times what they'll do when they pull you over for drunk driving, okay? So you're going to close your eyes, and you're going to take the tip of your pinky and touch the tip of your nose. You should be able to hit it, and you shouldn't be able to like search for it. You should be able to go right to it on both sides, okay? So you can do those tests to check, hey, is my cerebellum part of my back problem? Now, here's the thing. If you do have a problem in the brain, in the cerebellum, your brain is just like a muscle. We can do neurological rehab or brain-based therapy to restore your cerebellum back to its normal function, just like as if a muscle was weak. So we can do that through eye exercises, canal stimulation, a bunch of different ways, oxygen therapy. So these are some of the things we look at in people with chronic back pain that get missed elsewhere. So I just wanted to share that with you today. I'll be sharing some other information with you on future emails. Have a great day.